Four more people. Okay, we've got enough people here. Eddie, did you want to just start real quick with yesterday's numbers from the health department?
Yes, I have those. Come back to me. I got them on another
Okay.
computer. Let me get them.
Okay. Russell, do you want to go over the MCH numbers from this morning?
Good morning, gang. Thanks for working with us here to get this done a little bit earlier today. Medical Center, we've had 1,459 cases test positive. Currently in the house today, we have 27 in-house right now. 18 of those are on 8 Central. 9 of those are in CCU. And out of those 9, 4 of those are on the vent. So we only have 4 on the ventilator today. Our COVID patient count is pretty scattered today. We have 2 from Focus Care, 1 from Deering's, 1 from Buena Vista, 2 from Winkler County, 1 from Alpine, 2 from Andrews, 1 from Crane, 1 from Alpine, and 1 from Rankin. So that's 12 out of our 27 are either from nursing homes or from out of town transfers. 5,251 have tested negative. We have 14 tests pending. No suspects in house. So a grand total, we have tested 6,724 so far through this pandemic. And so that 27 number is better today. We like that. I know we were on a statewide call earlier this week, and it does sound like the state as a whole is flat, if not flat to somewhat, maybe a little down. The governor has a big call today at noon. We're looking for some new guidance, especially on his executive order that expires on the 29th. So I think we can all expect the mask mandate to probably stay around, which is not a bad idea. I think it's a good idea. But we'll be really listening to what he does as far as hospital and nursing home visitations and what that looks like. And so we'll keep everybody posted on that. I know Stacy and the doc, they're anxious to hear that too. So that'll be at noon today. And with that, I'll hand it over to Kristen, let her take it from there.
Just a quick report on visitation. We started in our emergency room on Monday, allowing 1 visitor to come into the department. It has gone very well. Everyone is bringing a mask with them. They're signing their release of liability forms if they're staying in the room with the patient, not wandering around. So everyone has been very helpful in making sure that the guidelines are followed, that we're not doing any undue exposure, and they've all been very appreciative. So after the governor's meeting today, we'll be meeting again on our visitation in hopes of beginning a more progressive rollout for other people in our facility to start accommodating some type of visitation. So we'll have more to come after that release today with the governor's office. That's all I have, Trevor.
Thank you, Kristen. Stacy, would you like to go over the ORMC numbers?
Yes, thank you, Trevor. Odessa Regional has tested 3,176 patients. We've had 446 of those test positive. The remainder are negative. We don't currently have any pending at this time. In-house, we have 8 patients. All 8 of those are in the ICU, with 3 of those on ventilators. 6 of those are Ector County and 2 are from Big Spring. And that's all I have, Trevor.
All right, thank you, Stacy. Dr. Saravan, you have anything you want to add?
Sure. Just on the visitor policy discussion, for consistency with the community, it makes sense for us to also consider what our visitor policy should look like. We're still discussing it internally. As of right now, we have the no visitor policy with the specific exceptions that we talked about before for pediatric, maternal, and end of life type situations, but we will probably start to open up similar to what MCH is doing. Maybe by next week, hopefully we'll have a process in place that we can do it as safely as possible, starting maybe with the surgical cases and the ER, and then expanding out as the as the disease control continues to stay at the level that we'd like it to be for safety reasons. The one other thing I wanted to add is a sort of a worldwide view of how this is doing. So we've talked about how it's doing in our community. In the hospital specifically, when we did our 1 week and 2 week positivity rate, we're about 10% within the hospital. I'm just talking about the tests that we do here. As a community, I don't have an exact positivity rate because there isn't one entity that sort of puts together all the tests that are done in our community and all the positive cases. We only have the positive case number. We don't have the total number of tests done. But when the city starts doing sort of widespread testing again, I think a positivity rate that comes out of the city's testing is probably a little bit more telling. So we can combine maybe the city's testing and the hospital's testing and come up with a positivity rate. But the point I was trying to make about the positivity rate is that we need to look at what other countries are even going through at this point in time. So if you look at parts of Europe, they're starting to see a surge of COVID cases again that they're calling a second wave. I'm not exactly sure what that second wave means. I don't know if it means that the virus has mutated and it's affecting people again, or if it's the same virus that they came down on precautions and it's starting to pick up again. I'm not sure one or the other, but I do know that those numbers are pretty high to a point where WHO is making alarming statements at this point to be very careful. So I think there's going to be some more restrictions with regard to travel that are either going to continue or going to get a little bit more tougher as this progresses through the rest of the world. America got the virus later than Europe last time for the first wave. So if that's what we're looking at, then it could start to hit us again during the peak of flu season. So we do want to be careful. And the mask mandate, I think, is probably one of the most important things we can do, because it not only helps with COVID, but it also helps with the flu virus, because it's also a respiratory virus. So I think that's something that we need to watch very closely as we start to make changes. It is good to celebrate our flattening of the curve and our precautions, but it's also important to know that we got here because of what we did with regard to precautions before, so we don't want to go backwards. So that's all I wanted to add. Thanks, Trevor.
Thank you, Dr. Sarah Bannon. Eddie, do you have the numbers pulled up from the county from yesterday, sir?
Yes, Eddie's ready. So
all right.
Cases, we have 4,536, 3,005 are confirmed, 1,531 probable, and 3,865 have recovered, which gives us an active cases of 579. We've had 92 deaths. We've tested 26,151. Our positivity rate is kind of trickling down a little bit. It's at 17.3%, but our fatality rate is edged up just a little bit, and it's at 2.03%. I also have a report on the nursing homes. Deering's nursing home, active cases are 17, and they've had a total caseload of 105. 74 have recovered and 14 deaths. Focus Care, active cases are 7. Total cases are 32 with 19 recovered and 6 deaths. Buena Vida, active cases are 16. Total cases 103, recovered 73, and 14 deaths. Madison Nursing Home, active cases are 3. Total cases are 15, recovered are 12, and they've had 0 deaths. Parks Assisted Care Living, active cases are 2. Total cases 7, recovered are 5, and 0 deaths. Courtyard Assisted Care Living, 0 cases currently, but they've had a total of 8 cases, 7 have recovered, and 1 death. That's the reports from the county, Trevor.
Thank you, Eddie. We can go ahead and get into media questions here. And it looks like first up is Danny. Danny, are you there?
Yep. Can you hear me?
Yes, sir.
Does anyone know how what the numbers were yesterday at McKinney Park on the testing? Who showed up?
No, we don't know. I don't think anybody knows, Danny, without a city representative here.
Okay. And then my other question is the flu shots. What is the average price for someone to get a flu shot that doesn't have insurance?
Uh, Eddie or Danny, from the marketing perspective, we're getting ready for that for all our clinics in there, and I believe it's $30 from what I've seen come through.
So, I mean, would there be any chance of having that price lowered for those that are low income and that, you know, that need one?
That is
So
the low.
Danny, I can probably give you a little bit more info on that. I did get an email from Brandy at the health department, and what she was explaining is that the health department currently does not have stock of the flu vaccine for this season yet, but it should be arriving soon. Also, currently they don't have any free clinics set up for administration of the vaccine. The only clinic that they're in the process of arranging is the back to school immunization clinic with ECISD. The health department will not be offering the flu vaccine for free. However, it'll be at a lower, more affordable cost for patients because they'll only be receiving a limited supply of those vaccinations. I don't have the exact number from her email, but that's something that they can probably get for you. What it says is lower, more affordable cost for patients. And for the city testing, Danny, it was 97 that got tested yesterday.
That cost is $25, Dr. Sarvan.
Thank you.
All right. Thank you very much. That's all I have.
All right. Thank you, Danny. Up next, Jared, you there? Do you have any questions, sir? All right. Next up, we got Royal McGregor taking Mike Marlowe's spot today from the Odessa American. You got anything, Royal?
Yeah. I guess the only thing that I had, can you hear me?
We can.
Okay. The only thing that I had was with the CDC coming out the other day saying that they would expect a vaccine like sometime next year, I guess, does that mean that everyone should be preparing to wear their mask for the foreseeable future, I guess?
I can probably take that question. So the CDC, like anyone else, has to make educated guesses on what the vaccine trials are going to produce. Nobody knows the exact answer for when a vaccine is going to come out. What we do know is that there is at least 2 of those vaccines within the US that are in phase 3 trials. I think I covered them before. One is from Moderna, and the other one is from I forgot the other guy, Pfizer. That's right, Pfizer. So that's the 2 that are in phase 3 trials right now. Both companies are saying that they'll probably be ready to apply for FDA's emergency use authorization sometime middle of next month. Well, we don't know. It depends on how the phase 3 trial goes, because there was one from AstraZeneca before that was even ahead of these 2, and there was a setback in the phase 3 trial with regard to safety. So they pulled back on the phase 3 trial, and that's not going to get approved sooner, as soon as we thought. So with these Moderna and the Pfizer ones, we'll wait and see if this application comes through. Even if it does get approved middle of October, end of October, there is still a production and a distribution phase. So you're not going to see widespread use of the vaccine probably for several months, at least 3 to 4 months after the vaccine has been approved, because that's how long it takes to mass produce and distribute the vaccine to the general population. So I think the CDC statements as to sometime beginning of next year is what I've been saying all along, is probably when we'll start to see a vaccine. It is very hard to predict because phase 3 trials are still trials, because trials can have 2 outcomes. It can either be positive or negative. So it's a wait and see game to see what's actually going to come out to market.
And I guess for the county, what is the real positivity rate?
Can you ask that question again?
Yeah, what is the positivity rate as far as like people contracting coronavirus?
17.3%.
That's all that I got.
All right. Thank
Thanks.
you, Royal. And then last but not least is Scott with CBS 7.
Hey guys, good morning. was either yesterday or the day before that the government mentioned they wanted to have a vaccine for everyone and that they wanted everyone to get that vaccine for free. Have y'all had any discussions yet begun about logistics of that at the hospital level? I know it's really, really early, but I didn't know if y'all had started talking about it or not.
I will say at the medical center side, our exposure team is actually meeting next week. We had several links sent to us on different articles and guidance under the Trump administration. So we have printed all of those. I know that our pharmacy department is working on storage of and need for that, while we'll work on what that might look like for our, let's say, our employees to begin.
Yeah, Scott, I was going to say the biggest conversation we're having right now is the actual storage of this vaccine, because it's got to be kept like at a -50 or -70
Yeah, I saw that yesterday.
Yeah, and there's a freezer out there called the Super Sub or some kind of freezer that goes -70, but you can imagine that they have skyrocketed in price and the availability has become very short. So we are, and I know the doc, we talked earlier this week about dry ice and how to keep this cold, but it looks like right now, as fast as it comes in, we're going to have to give it out, because being able to keep it at a -50 or 60 degrees is going to be very difficult until some more freezers become available. But imagine that. I mean, that's cold. -50 and 60 is very cold. And so
that's when I keep my apartment. So if you want to store them with me.
Well, so that's been our conversation, is things like that. But we think once it arrives on the ground that we're going to have to move it very quickly to so it doesn't get damaged or ruined. So that's kind of
the only thing I'll add to that is that both companies are still working on production and transport logistics. So Moderna has come out and said they're going to try very hard to make the medium so that it does not require that low a temperature. But this is such a developing situation that we don't know exactly what will happen. I think that's jumping the gun to say, exactly how we should prepare when the vaccine hasn't even completed the phase 3 trials. So it's great that we are preparing. It's great that we have the knowledge sharing, but it's not something that we can take definitive steps on until the actual approval comes through before we know what the needs are going to be at a hospital level. So at a corporate level, we're keeping up with this news, and we're looking at ways in which we may be able to get this vaccine stored at corporate and maybe ship them 2 days at a time to be able to use within the hospitals. But it's not something that we are preparing to do. Like, it's not like we're ordering the freezers and getting ready for it. Not until that emergency use authorization actually goes through.
Got it. That's all I have. Y'all have a good day. Thank you.
All right. Thank you, Scott. I believe that's everybody. I guess next week we'll go back to our regularly scheduled Thursday, 3 p.m. Does anybody else have anything they'd like to add before we go until next week?
I've got a closing thought.
I got one more thing that I wanted to add. I've had a lot of questions from different people in the media about the flu vaccine specifically. So I do want to speak on this so that we all understand. There's 2 disease processes that are going to be in play over the next several months. Both of these disease processes are going to be respiratory viruses. One of those disease processes we know how to prevent because we have a vaccine for and have had for years. And we know the safety information. We know how it works. We know what the population is that it affects. The second disease process, we're working to understand and we're working to develop a vaccine on. So if we had a choice of what we should do as a community, we should definitely take the one that we know for a fact that works and get everybody immunized so that there isn't a chance for a synergistic disease burden increase, because we don't know how the flu virus and the coronavirus are going to work together. We don't know if they're going to work together and make things worse, or we don't know if they're going to work against each other and hopefully not make things worse. But that is a guessing game till we go through our first season. What we know for sure is that the first one we do have a vaccine for. So let's all find a way to get this vaccine and get this vaccine so that we can keep the flu disease burden as low as possible, so we can reserve as much capacity to continue to take care of COVID-related cases if we are to have a second wave in our community. That's all I wanted to add. Thanks, Trevor.
Thank you, Dr. Servant. Russell, you want to close this out?
I sure will. Proverbs 3, 5, and 6 says, trust in the Lord with all your heart, lean not on your own understanding. In all your ways, acknowledge him, and he will make your path straight. Y'all have a great day.
We'll see everybody on Thursday.